This is Martin, your hemorrhoid expert, and today I'm going to talk to you about a hemorrhoidectomy versus a rubber band ligation procedure. If you have hemorrhoids, you possibly want to use one of these procedures or surgeries to get rid of your hemorrhoids. So I'm going to talk about them very briefly, the pros and the cons to each. A hemorrhoidectomy is good for internal hemorrhoids grade 2, 3, and 4, whereas a rubber band ligation procedure is typically only good for internal hemorrhoids that are grade 1, 2, or 3. Usually you don't need a procedure on a grade 1 internal hemorrhoid. That would be something to talk to your doctor about, but typically they don't require procedures. So if you have a grade 1 internal hemorrhoid, you probably wouldn't need a hemorrhoidectomy or a rubber band ligation. But if you do have a grade 2, grade 3, or a grade 4 internal hemorrhoid, these two surgeries or procedures are options. And like I said, the grade 4 is not treatable with a rubber band ligation. At least most doctors would recommend a hemorrhoidectomy. There are some pros and cons to each. The pros to the rubber band ligation is that it is cheaper. The one thing is, though, is that you, in many cases, have to get the rubber band applied more than once. There was a clinical study of 232 people, and I think about 75% of them had to get the rubber band applied more than once. Now, as you can see here in this graph, they're using forceps to grab the internal hemorrhoid, but there's actually some new rubber band ligation procedure where they use suction, and it's much less painful. So if you are going to do the rubber band ligation, you'll want to ask your doctor if you can use, if he has the suction as opposed to the forceps, because the forceps are very painful. And that's another thing. The rubber band ligation typically is not as painful during the procedure and not as painful post-procedure. The hemorrhoidectomy obviously takes a lot longer of a time. You have to get it cut open. Sometimes you might need anesthesia. It's just a much more invasive surgery. Oftentimes there's more bleeding. You can have bleeding with rubber band ligation, but it's not nearly as much as the hemorrhoidectomy. So, the rubber band ligation it's cheaper. The recovery time's a bit easier. Those are some positives. Clinical studies have shown, though, that the hemorrhoid comes back less frequently with the hemorrhoidectomy. So that's something to think about. And then, typically rubber band ligation was not recommended for external hemorrhoids, thrombosed external hemorrhoids. So, a bad thrombosed external hemorrhoid would require a hemorrhoidectomy or something along those lines. But the CHRO Reagan system says that they have some success treating external thrombosed hemorrhoids with rubber band ligation, so that's something to think about as well. So yeah, really, if you have a grade 4 internal prolapsed hemorrhoid, you're going to want to probably go with a hemorrhoidectomy or talk to your doctor about other options. Grade 2 or grade 3, you may want to do the rubber band ligation. It's cheaper and less painful, and has relatively similar success rates. So, that's something to think about. I hope you enjoyed the hemorrhoidectomy versus rubber band ligation video. If you have any questions, comment below.